Okay, so postpartum hemorrhage. This patient is a young patient. Okay, now postpartum hemorrhage is common, of course, after multiple deliveries. Yeah, it could be, of course, multiple deliveries. Patient have given birth, for example, 5-6 times before, and now there is an atonic uterus. The uterus fails to contract, or it's a first delivery. It's a young patient. Okay, and again, it's an atonic uterus. The uterus has failed to contract. Okay, now depending on how much blood has been lost. So this particular patient has lost a significant amount of blood and he is drowsy. So when you begin the beginning airway, hello, Mr. Brown, how are you doing? Can you hear me? Patient is mumbling. Okay, so this patient in this case is mumbling, is drowsy. So the conscious level is what? Is reduced. You can assess the GCS in here. So since the patient is drowsy, the GCS could be compromised. I would assess the GCS. So you can do the GCS here now. But when you assess this particular GCS, when you assess the GCS in here, it's not going to be 8 or less. So for example, you know, you're going to go there. Okay, Mr. Brown, can you lift, Mrs. Brown, can you lift your right arm? Okay, examiner goes, patient is lifting the arm. Okay, can you open your eyes for me? Patient is opening the eyes. Can you hear me, Mr. Brown? Is mumbling. So sounds is incomprehensible, 2, but is obeying commands, 6. So that makes it 8 already. Eye opening is to loud voice, 3. So the GCS of the patient is 11. So there is no compromise of the airway. Okay. So we can assess the GCS in here because GCS is reduced. We can do it at A, and then, you know, then we move on. Okay. So now we go to B, respiratory oxygen abnormal. As usual, you give oxygen. Okay. Then you're going to try to take a history. Patient is very drowsy, won't be able to take a history. Ask the questions. How are you feeling? Is something bothering you? You still have to attempt it. Is there something bothering you? Are you in pain? Are you having difficulties in breathing? Okay. So let me just look at your monitor. So there's no temperature in the monitor. Again, she just had the delivery. So you're going to have to look at what? On the patient's notes. I need to look into your notes to see, of course, if there was any problems or any complication during what? During delivery. Yeah. So again, look at the drug chart, look at the patient's notes. Okay. Now what I need to do, I need to examine you. You're going to have to continue speaking to the patient. You examine the chest, it's all normal. So there is nothing to manage. Okay. Now, when you come to circulation, you look at the circulation, the blood pressure is low, the monitor shows sinus tachycardia. As usual, somebody who's bleeding. Okay. You can auscultate on the heart. Now come to the examination, abdominal examination, you palpate. You may find that the uterus is soft. Usually they may give you the findings that, doctor, the uterus is flappy or the uterus is soft. External genitalia, when you have a look, you're going to see there is what? There is a bleed. Okay. There is a bleed, significant bleed, but you have to look carefully because you can miss a bleed, even if it's significant. Now you manage circulation. What you're going to have to do, okay? So get an IV line. You send the bloods. You start IV fluids as usual, aggressive 1 liter in both arms, IV, okay? And then you explain, okay? Check the PPUs, check the glucose of the patient, okay, or normal, review the treatment, A, B, C. B, you give oxygen. C, you give IV fluids, but you have to stop the bleed in here as well. So you're going to have to suggest what you're going to do. The patient has got what? Has got a postpartum hemorrhage, yeah? Okay, or give IV oxytocin and perform massaging of the uterus, because you have to get an IV line in here for you to give IV oxytocin. You might do these things and then arrange it, and then, you know, of course, do massaging of the uterus. That is to stop the bleed. Yeah, that it can be applied in here. In this station, you may have a nurse. If there is a nurse to assist you, then of course you explain to the nurse this postpartum hemorrhage. We need to stop the bleed. To stop the bleed, we need IV oxytocin and we need massaging of the uterus, manual massaging of the uterus. Yeah, good. We can do this at C, no problem. or we can assess in here and do it at D, no issues, but at C needs to be done because we also need to stop the hemorrhage. Okay, so put an IV line, do this, and as part of stopping the hemorrhage is IV oxytocin. What does it do? It will cause contraction of the uterus, and that will stop the bleed, and plus the massaging as well. Okay, so we'll do them at C. Then you go in here, which means just going to do the GCS. We did it at A, pupils, glucose normal, review the ABCs again. Now what's the blood pressure? Now what's the oxygen and the rest. Then you go to E. When you go to E, we have already looked at the abdomen. We have looked at external genitalia. So just have to look at the legs and palpate, and it's done. The blood pressure improved. Usually the blood pressure improves. Okay. If the blood pressure fails to improve, what shall we do? We go for group O negative blood to push up the blood pressure. Okay. But of course, the key issue is to stop the bleeding, IV oxytocin, and the massaging of the uterus. Now, so further management. Now, because the patient is drowsy, you discuss management with an examiner. Everywhere, if the patient is unconscious, is drowsy, is confused, these scenarios usually is to discuss management with an examiner. Because it's confused, you can discuss. Because it's drowsy, you can discuss. Because it's unconscious, you can discuss. Okay. So what you're going to do in here, discuss with an examiner. So I've assessed Mrs. Brown. Okay, she's came to give birth. Okay, the background, this is her first delivery, or this is her fifth delivery. Okay, she was unwell, feeling, with the shortness of breath. The oxygen was low, the blood pressure was low. She has a significant PV bleed. On examination of the abdomen, the uterus was soft. I feel the diagnosis is a postpartum hemorrhage, secondary to atonic uterus, secondary to atonic uterus. So what I would do, I would continue the current treatment, the IV fluids. Okay, I would discuss, I would need to involve my seniors, okay, and if we and discuss with the seniors the need of IV oxytocin and of course massaging of the uterus. Okay. So the examiner wants to know the management, what you do. Now, if you have to hand over, you have to hand over this particular patient to the crash team, then you have to learn how to do the handover as well. So you have to use an SBAR approach. If you have to do the handover, then we need an SBAR approach. So that's the SBAR, that's the SBAR. So S is a situation. You're handing over to your senior registrar, to your consultant, either your registrar or your consultant, or to the team, the crash team. You start with your background, okay? Hello, my name is Samson. I'm one of the FY2s. Hello, my name is Joseph. I'm one of the FY2s on the ward. Okay, I've got a patient with the postpartum hemorrhage. Okay, so the blood pressure, the oxygen initially was this. After fluid, it came to here. Okay, so basically, you tell what is your problem. Okay, you tell what is your problem. But the way we're going to execute ours, we're going to be simple and explain. My name is XYZ. I'm one of the FY2 in obs and gyne. Okay, I've got a patient with postpartum hemorrhage. What's the background? So this is a 17-year-old who has come to give birth for the first time. She has delivered a healthy baby, delivered 2 hours ago or 1 hour ago. Since then, she has been bleeding. Then you come to assessment. That's what I'm going to say. Initially, the oxygen was 88. After giving oxygen, it became 97. The blood pressure was 8/50. I gave fluids and it became, 100/70. Okay, and upon assessment, she had a significant PV bleed. She had a soft uterus. Okay, so that's your assessment. I feel that the patient has got a postpartum hemorrhage secondary to atonic uterus. Recommendation, your recommendation. Okay, and I feel that the patient needs IV oxytocin, need manual massaging of the uterus in order to stop the bleed. So that's your recommendation going forward. So again, my name is Joseph. I'm one of the FY2 in obs and gyne. Okay, what is your situation? I've got a patient with postpartum hemorrhage. What's the background? The background is a 17-year-old who has come to give birth for the first time. Okay, this is our first delivery. Upon assessment, the oxygen was low. It was 88. After giving oxygen, it became 97. The blood pressure was very low, 80/50. after IV fluids, it became 97/66. Okay. Upon assessment, abdominal examination, the uterus was soft, and on a external genital inspection, she had lost significant PV bleed. She has lost significant blood. Okay. Or she has a significant PV bleed. So I feel, as part of your assessment, what's your diagnosis? I feel the patient has postpartum hemorrhage secondary to atonic uterus. What is your recommendation? I feel that the patient needs IV oxytocin, continue the current treatment, and the manual massaging of the uterus. Okay, so if you're doing a handover, so that's an SBAR approach. Yeah, SBAR.